Now we'll take questions for the first session, that is on epidemiology. So the questions are, Dr. Kamlesh Sharma will read the questions and also give you the answers. Please read the question first.
Hello, good afternoon. So the first question is, does frequent gargling help in case of COVID-19? Now this is a very often asked question. My answer to this would be that it is a soothing exercise, but it cannot be treated as a curative or therapeutic measure. So it can be used as a supportive measure in case of COVID positive cases.
Second question.
The second question is with regard to the mode of transmission. Is COVID-19 airborne disease? So mainly I would say it is a droplet and it is transmitted through the droplet and fomites. But in some selected specific conditions, like for example, if somebody is carrying out the procedure of bronchoscopy or doing the tracheal toileting, suctioning, aspiration, etc., there are chances of aerosol generation. So in that case, those people who are around the patient while doing this kind of procedures, they need to be extra cautious and need to use all the preventive measures. The next question is with regard to the spread in our country, that is in India, considering the level of spread that is happening, what public education has to be focused on. So to my mind, the main focus should be on social distancing, on hand hygiene, on for the, like, in case there are suspected cases or confirmed cases, it is always better to focus on the isolation and quarantine practices in these conditions.
Next question.
There is another question with regard to source of COVID, the animal source of COVID. So as in the video you would have seen, there are broadly two modes of transmission which are considered right now as per the evidence available. One is from animals to human beings and the other is from man to man or person to person. So the animals which are considered in the initially it was thought that it was the snakes, and thereafter whatever evidence is available on epidemiological investigation in China in the Wuhan case, so that has shown that most probably it is the bats, considering their genetic makeup. And the other animal that is also being considered as a source of COVID infection is pangolins, which are mainly found in African and Asian countries. Another question is with regard to the stages of COVID-19. So what are the stages of COVID-19? There are broadly three stages. In stage 1, we could say that the cases are mostly from the affected countries, and this happens amongst the travelers. When the travelers return, so local transmission may happen of these positive cases, and that would be stage 2. India happens to be, as per the experts from the ICMR, India happens to be in that particular stage now, that is stage 2. Stage 3 is when the disease spreads in communities. Large areas are affected, and many times we are not able to find out what are the contacts and from where this infection has been contracted. Stage 4, the disease becomes out of proportion when there are large number of cases happening over a geographical area, like in an epidemic. There is no clear endpoint, and Italy and China, these countries are right now in stage 3. Stage 4, so as I said, that is Italy and China, these two countries are in that stage right now. There was another question with regard to the incubation period. For what, during incubation period, for how long a person would be infected. And there was another question with regard to the total incubation period. So as of the information available so far, it is seen that the incubation period ranges somewhere from 2 to 14 days. But there could be a median period of another 5 days after the exposure. Some experts rather say it can be up to 21 days. Then, how long a person would be infective, or how many people a person can infect during the incubation period? So there are two things here. This person can infect more individuals during when the disease is more severe, and on an average one individual is presumed to be able to infect another 2.8 individuals, that is 3 persons. There was another question with regard to the care providers. If someone, or a healthcare provider who is having mild to moderate asthma, can this healthcare provider look after the COVID positive cases? Now, the answer could be yes and no. In case the person is having active disease, probably no, unless it is under control. Even then, it would be advisable to consult the treating physician. Then the other question is pertaining to the main symptoms. In the video, I have discussed with regard to the prominent symptoms, sign symptoms, and also some of the other symptoms which are not so frequent. So the major sign symptoms which are seen so far are fever, dry cough, and breathing difficulty. There can be others. Some others have reported like rhinorrhea, or it could be headaches, it could be even loss of smell, loss of taste, etc. Another question was pertaining to the death rate. How much is the fatality of COVID-19? So it ranges somewhere between 2.5 to 5%, on an average 3.4%. That has been seen to be the case fatality rate in case of COVID-19. Incubation period I have already said. So one more question was pertaining to the mode of transmission, whether it can be transmitted through the stools, and if not, then why to do the urine and stool testing. Now, first of all, there is not adequate evidence with regard to the transmission through the stools. COVID-19, this virus has been isolated from the stools, but it is not clear whether it is able to transmit the infection in adequate amounts or not, or in like considerable amounts or not. So further studies are required in this direction. That is why it is always suggested, it is better that one does the hand hygiene after the toileting or after defecation, etc., and also before eating the meals or touching the meals. One more question was with regard to how much of the temperature range can be there in the people who are having COVID-19 infection or disease. So this temperature can range somewhere 38 to 39 degrees centigrade in general. So these were some of the important questions that were asked.